We are back with more on the health care fight now, joined via remote by Senator Chuck Schumer of New York and Senator Orrin Hatch of Utah. Welcome to both of you.
Morning.
Nice to be with you.
Senator Schumer, I would like to start with you. The big debate this week is about the public option, the idea of a government health plan that would get some competition going with private insurers. This is what you said about the so-called public option back in June. The bottom line is that we need to rework our healthcare system to lower out-of-control costs and to insure more Americans. Our current system, dominated by private insurance companies, simply has not done the job. That is why providing a robust public plan option as a choice for healthcare consumers is an essential part of the solution. Do you stand by that? Is it still essential?
Yes, it is. And the reason is very clear. The costs of health care are going through the roof. And most people don't see that yet. They're paid for by businesses or the governments. But we're going to hit a wall very soon. In 7 or 8 years, Medicare will go broke, and that will leave millions of senior citizens in trouble. On the private insurance sector, it's the same thing. Costs have gone up. They've doubled in the last 7 years. And if that continues, and it's likely to if we do nothing in the next 7 years, there will be millions of Americans whose employers will tell them, you no longer have insurance, we can't afford it, or your coverage is much less. You're going to get less and have to pay more through deductibles. So we have to do something. And the private insurance industry is highly concentrated. 94% of all markets are highly concentrated, according to the Justice Department. In most states, only 2 insurance companies, 40 of the 50 states, 2 insurance companies dominate. What is the way to bring costs down? The good old-fashioned way is to bring competition. And the public option we've proposed is not one of these big government control things. The government sets it up. It has a different model. It doesn't have to make a profit or merchandise as much, so its costs are probably 20% lower. But then on a level playing field, it competes with private insurance. And one thing I want to underscore, David, it is not a mandate, it's an option. If you like your present insurance, whether you're an employer or an individual, you keep it, and it doesn't change.
Senator Schumer,
if you don't like it, you have an option of the public option, which will help bring costs down. And so it is indeed essential to getting the costs down, which is our #1 problem.
You're not backing away from it, but there is concern within the Democratic Party that President Obama is backing away. Here was the headline in the New York Post this week that spoke for a lot of liberals, actually, both publicly and privately. Sellout. Liberals howl as BAM caves on the health plan. This is what the reference was to. The president's weekly radio address back in July, during which he said this.
That's why any plan I sign must include an insurance exchange, a one-stop shopping marketplace where you can compare the benefits, costs, and track records of a variety of plans, including a public option to increase competition and keep insurance companies honest, and choose what's best for your family.
That was July, but just a week ago, the president said this.
All I'm saying is, though, that the public option, whether we have it or we don't have it, is not the entirety of health care reform. This is just one sliver of it, one aspect of it.
You say it's essential, Senator Schumer. The president's saying now it's just a sliver. He's backed away, hasn't he?
I don't think he's backed away at all. I've talked to the president personally about this in the last few weeks. He believes strongly in the public option. Obviously, he is working hard to get a bipartisan bill because that would be a better bill. But I believe that at the end of the day, we will have a public option. And frankly, I believe we could get a public option that could be passed with the 60 Democratic votes we had. A level playing field public option where the public option competes on a level playing field with the insurance companies, was backed in the House by both blue dog Democrats and more liberal Democrats. And I think that's the direction we're going to end up in.
Senator Hatch, let me bring you in here. Has the president backed away? Does it create an opening for Republicans to maybe work out a compromise?
Well, I think the president realizes that a public option isn't the last answer to everything. As a matter of fact, both independent groups and others in government indicate that if we go to a public option, millions and millions, tens of millions of people will go into the government plan. And the problem with the government plan is that Medicare, for instance, is a government plan. It's $39 trillion in unfunded liability. It's going to go bankrupt within the next 10 years. The costs of the government plan will be astronomical. Keep in mind, in Medicare, they pay doctors 20% less, they pay hospitals 30% less. Guess where those costs are transferred? They're transferred to the people who have private health insurance, and the average private health insurance policy goes up about $1,800 a year just to pay for what the government fails to pay for in their current government plan. So we're going to throw out, we have 300 million people in this country, 85% of whom have insurance. Both sides believe that, both Democrats and Republicans believe that we should reform the insurance industry. There's no problem there. The real problem is, are we going to go to a government plan that can't even take care of what we have in Medicaid and Medicare? And the point is, if you go to a government plan, both independent analysts and government analysts, the CBO, have indicated that tens of millions of people
well, wait a minute,
into the
Senator Hatch, that's not right.
Destroy the private health insurance.
The Congressional Budget Office did not say that. In fact, what they have concluded
yes, it did say that.
Well,
yes, it did.
The CBO said that, in fact, those enrolled in private insurance plans would go up by 3 million, and they estimate that about 10 million people, only 10 million people go into a public plan.
Well, didn't I say tens of millions of people? Others have said
that's different than 10 million.
Well, that's plenty. But others are saying up to 119 million people. It ranges in between. The point is, it's always more than what the government says it is. Look, I don't think people in this country believe that the federal government controlling everything is the best system of last resort. I think we should have more flexibility in the states to solve their own problems. For instance, New York is not Utah. Utah is not New York. We have a tremendous health care system that works out here. They don't in New York. Massachusetts has that so-called connector system. They now haven't added people over the last 2 years because they're almost bankrupt because of the cost of their government plan. You know, if you go down through it, anybody that believes that the federal government is going to take this over and do a better job than the private sector, even with all the faults of the private sector, I think just hasn't looked at the last 30 years.
Senator Schumer?
I would just say this, yes. The problems, Orrin is right. Medicare costs are out of control. So are private sector costs. That relates to the fundamental problems in the health care system, and it's why President Obama feels we have to take this on. Because if we don't, both the public sector, Medicare, and the private sector, private insurance companies, insurance is going to become so expensive that people won't be able to get it. And it's not 20 years away, it's 5 to 10 years away. So it takes a lot of courage to take this on. What I would say is this: we need to get at these fundamental cost problems, and we ought to try different models. There is no mandate with the public option. That's one of the myths that's been put out here. It's like a college system. In New York State and Utah, there are public colleges, private colleges. You choose the one that's best for you, and competition makes both of them better.
All right, that's fine. You're arguing the merits of the public option, but I want to go back to where the president is. Senator Hatch said that the president realizes that it's a non-starter, certainly among Republicans, but Democrats as well. The Gang of Six, so-called, working right now on your Senate Finance Committee, they're not talking about a public option, and the president is saying publicly, look, it's just a sliver of reform. Is he not walking away in order to get some kind of compromise?
No, if you read what Mr. Gibbs said and others have said after Secretary Sebelius's comment, it's clear that they much prefer a public option. Obviously, we are going to try to get a bipartisan bill, but a public option to many, many objective observers is essential to bringing those costs down because it provides competition, and at the end of the day, we will have one. We will have one, because I believe even if every Republican says that they will not be for a public option, we can find a level playing field, level playing field type public option where both insurance companies and this option compete, and we will get 60 Democratic votes for it.
Is that the idea of a co-op? Is that the idea of a co-op that operates in the states?
Well, a co-op is a little different because it's not set up by the government, it's set up by cooperators. But I think you need, in whatever comes about, and I much prefer the public option, you need three things. First, it has to be available on day one. This can't be triggered down the road 4 years from now as the private insurance industry just again, in its very, very non-competitive way, continues to raise costs. Second, it has to be available to everybody. I know that Senator Grassley, my good friend, has this idea of 100 farmers getting together in Iowa and forming a co-op. That's great. But that's not going help the rest of the citizens of Iowa or of New York or anywhere else. And third, it has to have the strength and clout to go up against the big boys, the big private insurance companies that actually run the show here. And they've been as responsible, if not more responsible, for runaway costs than Medicare has.
Senator Hatch, you're a good friend of Senator Kennedy's. You have walked away, in fact, from these negotiations with the Democrats. What impact is the loss of Senator Kennedy day to day on this compromise, this search for a compromise having?
Well, Senator Kennedy, first thing he would have done would have been call me and say, let's work this out. And we would have worked it out so that the best of both worlds would work. Now, just think about it. These people want to take and create a government plan when Medicare is $39 trillion in debt right now. And the way they're going to do it in both the House and Senate bills is they're going to take $400 to $500 billion to pay for this new plan out of Medicare. And not only that, they're going to set up an IMAC. It's called an Independent Medicare Advisory Council that's going to set just all the terms and conditions of health care. And that means rationing in anybody's language, and I think you've got to be concerned about that. Last but not least, we have 300 million people in this country. Well, let me finish, Chuck. Let me finish.
Go ahead.
We have 300 million people in this country, 85% of whom have health insurance. The other 15%, you've got 6 million people who actually qualify from their employer but don't get it. You've got 11 million people who qualify for CHIP and Medicaid. You've got another 9 million people who earn over $75,000 a year, can afford their own health insurance but won't do it. You've got 6 million people who are illegal aliens getting health insurance. When you bring it down, that 47 million people comes down to about 15 million people. So we're going to, and we all know we need insurance reform, both Democrats and Republicans, but we're going to throw out a system that works for 85% of 300 million people to take care of 15 million people that we could take care of with subsidies and other approaches that would be simple.
Senator Schumer,
I would never go to a federal government program. If we do that, we'll bankrupt the country.
Senator Schumer, before you respond to the substance of that, I want to ask you a tactical question.
Yeah. Okay.
Will the Democrats consider reconciliation or breaking up the bill in some way to the point where you'd only need 51 votes to get it passed? Is that under discussion?
The bottom line is we prefer a bipartisan approach, and that's why both Senator Reid, our majority leader, and President Obama bent over backwards. You know, it was supposed to be done, the bipartisan bill, by June 15th, June 30th, July 15th, August 1st. They're bending over backwards. But at some point soon after we get back, if we don't have a bipartisan bill, we'll never be able to meet the goal of having a bill signed into law by the end of the year. So yes, we are considering alternatives. They include just getting 60 Democratic votes and maybe an occasional Republican here or there on a bill. If we can't get a bipartisan bill, try as we might. They include looking at reconciliation, which only needs 51, and they include a combination. We are now looking at the alternatives because it's looking less and less likely that certainly the Republican leadership in the House and Senate will want to go for a bipartisan bill. John Kyle has said he doesn't want a single Republican vote for any health care bill.
On that point of bipartisanship, or the lack thereof, Senator Hatch, this is what the president said during an interview this week with Michael Smerconish in Philadelphia about what Republicans have made a decision about. Let's listen to the president.
I'm confident we're going to get it done. And as far as negotiations with Republicans, my attitude has always been, let's see if we can get this done with some consensus. I would love to have more Republicans engaged and involved in this process. I think early on a decision was made by the Republican leadership that said, look, let's not give him a victory, and maybe we can have a replay of 1993-94 when Clinton came in. He failed on health care, and then we won in the midterm elections, and we got the majority. And I think there's some folks who are taking a page out of that playbook.
Senator Hatch, is he right? For Republicans, is health care his Waterloo? Is that what they want to make it?
Well, I wouldn't call it that, but it's extremely important because what they're trying to do, you know, almost anything you look at in the, you look at the two Senate and House bills, Number one, they demand a public plan. Whether you call it a co-op plan or not, it's going to be a public plan, a government plan. Number two, they want employer mandates, which basically kills people on the lower end of the wage spectrum. They're either going to lose their jobs, be cut back in pay, or the companies are going overseas. And number three, they want to push people from private health insurance into Medicaid, which could destroy
But I'm asking
Medicaid.
about, Senator Hatch, I'm asking about tactics here. Have Republicans made the decision that if you beat them on health care, you can beat them in the midterm next year? And that's been the guiding principle.
No, that hasn't been an approach on the Republican side, but I do admit that I think virtually every Republican realizes that they want this government plan almost at all costs. And the reason they want to move the way they are is to move to a single-payer system like Canada's, Germany, France, England. Wow. Now, choose any one of those over ours, and I'll tell you, you don't know what you're doing. No. Our plan, as bad as ours is in some ways, and it does need reform, I've got to tell you, it's head and shoulders over any other plan, any other government in the world. But we need to work on it together. But I've got to tell you, they're insisting on these, I think, legislation-killing approaches that literally Republicans cannot go along with. There are 6 Republican bills. Whether they have a chance or not, I don't know. But let me say this. I said from the beginning that they're going to go to reconciliation, which has never been used for a substantive approach of 1/6 of the American economy, or even a smaller substantive approach, and that would be an abuse of the process. That was set up, reconciliation, to solve increasing taxes or lowering taxes or cutting back on public spending or spending more. The fact of the matter is that they use that would be an abuse of the process.
Quick response, Senator Schumer.
Let me just say this. I want to focus on the public option. You know, there are some Democrats on the left side who say it should be the government only, like Medicare. There are some on the Republican side, too many in my opinion, who say only private insurance companies. Why shouldn't we have an option where both compete and see where the public decides, provided it's on a level playing field? That's fair, that's down the middle, and that's where I think we're going to end up at the end of the day. Not with rationing, not with government control, but just with a little competition, which the private insurance companies don't afford us right now.
All right, Senator Schumer, let me just get in here on a final point here. In other news, with the response that we saw in Libya this week to the return of al-Megrahi, the convicted bomber in Pan Am 103. This was the response that he got in Tripoli on Thursday. A lot of folks back in New York who were family members of the victims of Pan Am 103 were horrified at those images.
Well, I was horrified as well. This is a disgrace, and I think there are 2 things that should happen. First, I think that our Secretary of State should immediately introduce a resolution condemning those celebrations and calling on Gaddafi to apologize for them. And second, frankly, I'd like to know if there was some kind of illicit deal here. There was a story in many of the newspapers that this was done, particularly by the British government, in return for getting an oil contract. That would be despicable. These families didn't get over their wounds for 8 years. They never will. And to let this person out, who was one of the greatest terrorists in the last 100 years, was despicable and will be a blot on those who did it for a long time.
All right, gentlemen, we're out of time. Senator Hatch and Senator Schumer, thank you both very much.
Thanks, David.
Up next.